Retail pharmacy is in the midst of major transformation, from the AI revolution to the industry's push for PBM reform. At the NACDS Annual Meeting, DSN sat down for exclusive interviews with executives from some of the nation's top retailers to get an insider view of their market strategy and to ask what's on their radar for 2025 and beyond. My guest today, Dave Puri, Senior Vice President of Pharmacy. So Dave, thank you for joining us here at Annual 2025. Last year, I interviewed your colleague, Leger.
Okay.
And he had told us about what you guys were cooking up in Canada. So pharmacy care clinics is relatively new for you, and a lot of people in the US are quite frankly jealous. So briefly explain to us how you're delivering care in your new setup.
Of course. Well, first of all, thank you for having me here today. It's a pleasure to be here. Let's set the stage first. So we have right now about 6.5 million Canadians without a family physician.
Mm-hmm.
We have a healthcare crisis in Canada, much like in many other markets around the world,
Right.
where right now we have, in addition to that, 6.6 million Canadians that have a family physician that's over the age of 65. Now that's a cliff that we're about to go over,
Right.
right? And then on top of that, you add in increased immigration we've seen over the last several years, an aging population, and the rise of chronic diseases like diabetes and hypertension. We're really getting into some difficult terrain here in Canada. And so when it comes to pharmacy and pharmacy care clinics, this was an idea we had, an innovative solution to be part of the solution, to provide access to care to Canadians on the front lines. And so going back in time, we opened our first pharmacy care clinic in 2022, so under about 3 years ago. And it was a pilot. We wanted to test out one location to see if there's going to be demand from consumers and the public for it. Fast forward, across all of Canada, we're almost in every market in Canada now. We have over 160 open as of today. End of this year, we'll have north of 250 clinics open, run by pharmacists across the country.
Yeah. And so we can't ignore the fact that what made that possible, though, is that in Canada, pharmacists are allowed to do things that they can't do here in the US. Yeah. Tell me a little bit about that.
So you're referring to scope of practice.
Right.
And even within in Canada, each province has a different scope of practice that a pharmacist can practice in. Mm-hmm. Right? The first clinic that we opened was in Alberta, a province of Alberta.
Right.
Over there, the pharmacist, or when you compare it to the rest of the country, has the broadest scope or the most advanced scope that a pharmacist can do. That's why we started in Alberta.
Okay.
Then when other provinces saw what's happening in Alberta with the pharmacy care clinics, other provinces start to open up scope as well if we would build pharmacy care clinics to support the need of the community. Okay. You know, I'll give an example. Nova Scotia has been a very progressive province in Canada. They, jointly with the association there, we opened pharmacy care clinics in Nova Scotia. Now, the Premier of Nova Scotia has mentioned that over the last 18 months, pharmacy care clinics have helped to reduce non-urgent or less acute or very minor visits to emergency departments by 10%. By 10%. Okay. And so this is an example of how pharmacy is providing care and access to care in Canada.
Yeah. So here in the US, there's a lot of talk of pharmacy and health, mixing with health, with wellness and beauty. Yeah. At Shoppers Drug Mart, how are you combining the two in your stores?
It's a beautiful relationship. If you come down or come north to Canada to see our beauty departments, some of them are just world-class, and I encourage you to come and pay us a visit to see our beauty boutiques. We have beauty specialists, and they work very collaboratively with our pharmacy teams, in particular when it comes to skin conditions. So our pharmacists, depending on the province in Canada, can prescribe for conditions like eczema or acne, as an example, or dermatitis.
Right.
And quite often there's a very nice handoff to the beauty specialists in our beauty departments on their skincare routine or regimen. Our beauty specialists have tools that a pharmacist may not be using, such as a derm tool, where they could check your hydration and also other skin conditions, and also then refer you back to the pharmacist for any support. For example, sunscreen as an example. Now I'm going to take you back in time when I was working in the front lines as a pharmacist. Even stuff like bacterial conjunctivitis, which is an eye infection, right? Some folks, some members of our patient population may have an eye infection that the pharmacist is providing care for, not realizing that quite often the mascara or eyeliner that they're using may need to be replaced as well,
Right.
because the infection will continue to rebound. And so in circumstances like that, you often see the pharmacist doing a very nice handoff to the beauty team to help replace their cosmetic products as well.
Yeah. Okay. So as I said earlier, we hear it all the time that pharmacists in the U.S. they're jealous of what you're able to do. They come up to Canada, they visit your stores, and they're really jealous when they see it. So what are you looking forward to in the future, and what are you trying to improve and expanding in terms of whether it's technology or omni-channel or all of that other stuff?
That's a great question. So at the crux of it, it's all about patient experience. And patients' experience and their needs and how they want to get access to care is evolving and changing. And so we have to evolve as well. So we have brick and mortar retail outlets across the country where patients get care. We also are looking at the omni-channel experience, and we look at it all across the world for best-in-class solutions on how we can meet the care needs of Canadians where they want care. So whether it's via an app, whether it's online, virtual care, etc. So we're looking at solutions all across the world that we can turn on in Canada as well.
Yeah.
Another thing that we do is we want to make sure we could free up capacity for our pharmacists. And we look at others to see how they're doing that as well. One solution that we've implemented many years ago, and we continue to refine, is central fill sites.
Right.
We have 7 production sites in Canada, servicing 9 provinces today. And we look at how we can bring in automation and different solutions to create capacity for frontline pharmacists to provide care in settings like the pharmacy care clinic.
So what role do you think AI will play in that?
AI, more on the consumer front. I see, you look at consumers looking to things like we joke in the industry as Dr. Google. You may look at Canadians and others look to AI for recommendations or where to get referrals. And our hope is that they continue to come to pharmacists to help get clarification on some of the recommendations that AI may be providing.
Yeah. All right, Dave, thank you so much for joining.
Nice to meet you.
Appreciate it.
Pleasure.